Since the age of 10, Karen Hoffman knew that she had an interest in the field of psychology. Although she initially planned to study music in college, it did not take her long to discover what her true calling was. After earning 2 master's degrees in psychology and social work, and passing an extensive exam, Hoffman became a psychotherapist for clients of all ages, which is a job she continues to love to this day. She incorporates this passion into her work, showing how much she cares about the well-being and progress of her clients. What strikes me most about Hoffman is that she uses a variety of approaches when assessing her clients. While some therapists remain firm towards one approach over another, Hoffman focuses on the performance of her clients and strives to find an approach that works best for them. It is clear to see that her goal revolves around her clients, as she wants more than anything to see them grow and achieve the goal they set out for. This interview was done outside a local Starbucks at 1:15 in the afternoon during a weekend when Hoffman was off of work. The reason it is here is because it was the most convenient place for Hoffman and I to meet. However, because of this location, there was some background noise that occurred during the interview, but not enough to cover what Hoffman was saying. I already knew Hoffman before this interview, as she is friends with my mom and her daughter is friends with my sister. The fact that we knew each other made it much more comfortable for both of us to conduct a successful interview. The questions in this interview start with having her describe how she became interested in psychology and explain the process of attaining the job she has today. Next, we will discuss her approaches and styles that she brings to her job. Then we will focus on how she handles her clients and the wide range of disorders she encounters. Finally, we will discuss the effect the job has on her as a person. By the conclusion of this interview, I learned that since the beginning of her education, Karen Hoffman knew that she was going to be in the field of psychology, and her love for it shows in her approaches and in the relationships she builds with her clients.
Okay, we're on. Testing. Hello.
So, what job do you have?
So, I am a psychotherapist. I have a private counseling practice that I do psychotherapy for kids, teenagers, and adults.
So what made you interested in psychotherapy?
I actually really liked my guidance counselor when I was in school, and I remember I was in 10th grade, and I thought that was like a really cool job that she had. But then I was actually going to study music in college and was offered a scholarship to do music therapy, and I decided I didn't really want to do that. So I decided to get my bachelor's in psychology, and then I went on and got my MSW, actually, my master's in social work. And that kind of led me on the track that I'm in now.
So you're saying you had other interests, but did you always think you wanted to be a psychologist or some sort of form?
I did. I was one of those weird people that knew since I was probably 10 what I wanted to do, and knew the whole way and never really deviated from it. Yeah.
Did you take any classes during school about it?
I did. I remember in high school I had a psychology class that I had to take, which was really cool, really interesting. Thought it was well done. I thought it was, touched on hopefully a little bit of what you're touching on too. And then what really kind of led me down my path was in undergraduate, I took a deaf and dying class, and I thought that was really very, very interesting. And because I ended up specializing in grief counseling, that's kind of the track that I went on.
Okay. So was it, can you explain like in more detail the process of getting licensed in psychotherapy, psychology?
Yeah. So first you have to, after you finish, well back then it was a little bit different than it is now. So I got my master's degree, and then you had to study for a special licensure exam that you prepare for and study, and you're not allowed to take that exam for 2 years post-masters, and it's extensive. There was a laws and rules test you had to take, and we would actually back then have to drive to Orlando and sit in a physical room, take the test, and not find out for 6 weeks if we passed it or not. And then there was a clinical test that we had to take as well. Nowadays, once you're done with grad school, you can take the test right away, and then you work under supervision of a clinician for 2 years, collect a lot of clinical hours, and then you could get your license.
Okay. How do you explain like your style with like your patients, your clients?
So I kind of take an eclectic approach, and I think most people in private practice do that. I don't know. I guess there are some therapists that have a very firm approach theory that they follow, but I take kind of an existential approach. I take a client-centered approach where it's more about the client, especially working with teenagers or adults, depending on where they're at. Cognitive behavioral is an approach that I use a lot. systems approach. So there's a lot of different theories that you kind of bring together when you work with clients.
And do you have a preference of the branch of psychology, like that you have a like cognitive?
I mean, I think cognitive behavioral is probably the most practical, and that's used a lot for people with depression and anxiety, definitely. But I really thought existential was interesting also, and I studied in graduate school an existential family therapy program, which was really cool. And when you do grief and loss, especially working with dying people, like I used to do much more back in the day, that was a great theory to kind of work with. Yeah.
Okay, so how do you like assess how well like your treatments are working? How?
That's a good question. Sometimes people want the quick fix. I think our country that we live in, everything just we want it boom so fast. But it's a process and it takes time, and sometimes it takes a lot more time than clients really want or what we really want. So if they have goals that we're trying to work on, the sooner that they meet the goals, then we know that what we're doing works and is effective. So I think being in communication, collaborating with clients on what their goals are, not my agenda, but theirs, we kind of can see. And then as people feel better and report that they're feeling better, we back off sessions and end up stopping.
How do you treat like coexisting disorders? Like, is there any situation where it's coexisting?
Yeah, so a big one might be somebody who is depressed and like using substances. So that's the big one that you see. I don't specialize in addiction counseling, so I might refer out for that because somebody can't really work on their issues unless they've already dealt with whatever they're addicted to, drugs or alcohol or whatever first. Some coexisting things might be depression, anxiety, but also post-traumatic stress disorder, which I do a lot of. So we prioritize and work with the issues that are most prevalent that we need to deal with up front, and then get to some of the other things over time too. Or divorce and issues, you have to deal with the crisis at hand first.
Do you use like medication, or are you against that or for use of medication?
So I'm not against medication. If it's appropriate, they should be on medication, but I think it's important to try counseling first, and then depending on if they're not improving and how severe their issues are, depends on the issue. If they're depressed and suicidal, they need to be assessed for medication for sure. If they have ADHD, they probably need medication. There's certain things, so I'm not opposed to it if it's appropriate for sure.
Okay. Do you work with doctors that are medical doctors?
Mm-hmm. Yep. Since I don't prescribe, there's psychiatrists that I work with and collaborate with and refer to all the time.
Yeah. What happens if like a client like refuses to take your treatment to talk to you? Is that happening?
Yeah, it does. So resistant clients sometimes don't want to come in, and maybe if it's a teenager, they're being forced to come in. So I have one I'm working with right now that she doesn't want to be there at all, but the mother's making her come. So it's kind of a little bit of a waste. They come and we try, and I work on the relationship and try to get her to open up, but it doesn't always work that way. Or if it's a spouse, a husband and a wife situation where the wife feels like the husband needs it or vice versa, unless they really want it, they're not mandated to be there. They're not necessarily going to approve unless they really want it.
So, what's your criteria for when a patient needs to be like hospitalized? If it's like more severe than?
Right. So definitely, if they are very depressed and they are dealing with a serious suicidal ideation, they have a plan, they know what they're going to do, they can't contract with me verbally or written that they're not going to hurt themselves. That's what we call Baker Act. That's when we'll Baker Act a client and get them the help that they need.
Okay, so regarding like parents and like of like the patient, if the patient is a younger patient, do you meet with the parents often?
So if they're little kids and it's behavioral in whatever their issues are, I probably speak more to parents than I do if they're a teenager, because so much of what my counseling approach is, and most therapists, it's about confidentiality. So if a teenager knows I'm reporting back constantly to the parent, they're not going to be as open with me. but I always will touch base and speak generally kind of how they're doing overall. Young kids definitely more involved than the parents.
And yeah, sorry I didn't bring this earlier up, but is there a range of ages? Are you every age?
That I work with,
Yeah.
I work with all ages. I've worked with even little 4-year-old kids who've had issues that are going on, loss, maybe parents are getting divorced or there's been a death in the family. So yeah, I work with all ages, up to 90 something for sure.
And you get a range of disorders, right?
Yep, I do. Yes, because I've been in Boca since '99 doing private practice, so I see it all. You know, just having been in the area, there's a lot more of referrals that come from just being in the area for so long. So all kinds of issues that you're dealing with.
And here's a question that might be a little more difficult.
Okay.
Is there a goal, like you assess for each like lesson? Like, do you set a specific goal for each like therapy? My bad.
Mm-hmm.
With the patient, like I'm gonna accomplish this today. We're gonna
Right.
make progress.
I definitely do that more with clients that have depression and anxiety, I would say. So I had a client come in who had a lot of anxiety, fear of driving on the highway. So the goal was getting her to feel comfortable driving on the highway. So definitely we'll be very specific. A client who was he was a teenager and he was I forgot what sport he played at basketball, and he had a fear of sleeping out of the house, but he was a very good basketball player, wanted to go to this very prestigious basketball camp, and because he had fears, we actually did hypnotherapy for him to help him work on achieving that goal, and it worked, and he went. It was great.
And is there like a certain time when the progress is assessed, and how was that?
I think in today's world, we're always assessing it. It's ongoing all the time. So maybe there'll be, we'll have a few sessions and then we're checking in and seeing kind of how things are going. There's no specific time frame, but it depends on what the goal is that people are trying to work on. If I push something sooner than they want, they're not ready. We kind of work together as partners.
Okay. So what's your favorite part about your job?
I love what I do. I really do. I love working with my clients. I feel very lucky. I don't ever dread going to work. My favorite part is seeing them feel better coming in, especially if they're coming in for something very tragic, like a significant loss in their life, and crying hysterically weeks on end, and knowing at the end they can live their life and feel great and be happy again. That's what it's all about to me.
And as a son of a mother in the psychology field, do you ever like apply any of those stuff you learn from your job into raising your children?
Yeah, that's a good question. So I definitely have more understanding being the mother of and having children, for sure. If you ask my kids, do I bring it home? They would probably say no, unless they're just trying to be funny and say, stop being my therapist, because I really don't. I really do leave it very separate. Work is work and home is home. I probably should apply some of the things that I use with my clients at home. It would probably be better. So I try to keep a little bit of a boundary, though, for sure.
Thank you.
You're welcome. My pleasure. My pleasure. Bye.